but you can't put a strict age bracket. But we still tell majority, once you're above 40 or you're approaching the age of 40, you should need to have a check because that might be when this thing creeps in.
And that's when, you know, the symptoms begin to manifest.
Exactly.
Really.
That
time.
Okay, all right, Dr. Fasase Inibadan, let me ask, does diabetes have a direct link, so to say, with sugar? Because when you talk about diabetes, people are always quick to say, oh, it's because your intake of sugar is high, or you should stop taking sugary drinks, you know, to prevent diabetes. Is that a direct connection, really, between diabetes and sugar?
There's link between diabetes and sugar, but whether it's directly linked or indirectly linked is the way a person presents. Now, at times it can be hereditary. If one's parent or grandparent has diabetes and one is consuming high doses of sugar, this is an environmental factor. It's likely that that person may come down with diabetes. Since diabetes has to do with the problem of sugar in the body, you know, whether there is no enough production of insulin or there is insulin resistance at the level of the cell cannot be utilized by the cell, and and the person is consuming more sugar, definitely the person will come down with diabetes mellitus. Therefore, one should just cut the consumption of sugar.
So we should cut down the consumption of sugar in our diet. Okay, let us look at other things that we do that most people tend to take for granted. I hear tobacco.
You know, Justin, sorry, let me cut in there. You know, sorry, I want to ask another question in line with the sugar thing, so that we are clear. A lot of times we are confused as to what sugar really is. People have different impression of what sugar is. So when we're talking about sugar, really, in terms of diabetes, let's be clear what we mean by sugar. What kind of sugar are we talking about, really? I don't know if you understand why I'm asking this question. Because what is sugar to me might not be sugar to the next, but what is sugar when we're talking diabetes?
Patients with diabetes should not take sugar at all, because the primary problem is utilization of sugar in the body. So patients with diabetes should not indulge in taking sugar. Sugar starts from taking things like soft drinks, which contain high content of sugar, or putting sugar directly into the pap. Most of the things we eat actually break down in the body to be glucose. So when there is problem in utilizing glucose in the body, there's too much in the circulation. We are not taking direct sugar. It will increase sugar in the circulation. Therefore, what we mean by sugar, like the granulated one, the cube one, the one in the soft drink, these are direct sugar. If diabetic patient has a normal sugar level, they should not take sugar, because that would definitely increase. But they can eat any food they want to eat, but in moderation. But sugar, they should not take sugar at all, except they have low sugar level in hypoglycemic states.
Okay, so invariably that this actually is countenance and the fact of carbohydrates linked to sugar as well.
Yes, I just mentioned that food we eat actually breaks down to glucose, like carbohydrates. But those ones will not, if the blood sugar, diabetic patient is already taking drugs and the blood sugar is normal, that one will not lead to increase in the sugar in the body. But sugar, as in the one in the one like granulated sugar, the one like a cube sugar, the one in the soft drinks, the soda, those ones are the content of those ones is a direct sugar. The patient with diabetes should not eat, but the one in the food will not lead to problem for patient with diabetes mellitus.
Reports say that tobacco use can also be related to diabetes. I just need you to clear that. And again, for people who are naturally big, they were born big, are they susceptible to having diabetes?
Yes, it's also known that patients that have diabetes should not smoke cigarette, they should not take tobacco, because that actually will displace the utilization of glucose at the cells, at the level of the cells. It will displace the utilization of the glucose at the level of the cell, thereby increasing the glucose in the blood. So patients that have diabetes should not take tobacco. What it will do, tobacco does not contain sugar, but actually it will prevent the utilization of glucose at the cell level.
All right, doctor. You know, in the past, we used to think that diabetes was an old person's disease. But with recent events, we can see that even children are coming down with diabetes. And I heard someone mention juvenile diabetes once. Can you please throw more light on what juvenile diabetes is and how really does it occur?
Yes, we now go down, let me simplify it. We now go down to what we call pathophysiology or mechanism, how diabetes occurs. Diabetes, all of us have pancreas, an organ in our body that produces insulin. If insulin is not produced enough from the pancreas due to one thing or the other, in most cases the cause is unknown. It leads to type 1 diabetes mellitus, which is also called insulin-dependent diabetes mellitus, IDDM. And in the past, it's referred to as juvenile diabetes mellitus because it occurs in children, in people less than 30 years of age. That's the cutoff. So if it's above that, you say patient have type 2. So type 1 has been related to juvenile diabetes mellitus because there is not enough insulin in the circulation, there is not enough being produced by the pancreas.
To you, Dr. Aegis, I just want to chip in a quick question now to you, Dr. Ogundele. I haven't talked about type 1 and type 2. I know the third one is gestational diabetes, which is for pregnant women. But not all pregnant women come down with that. So what exactly triggers that?
We can't really put a hard and fast rule on what triggers it, especially in pregnancy. There are like several conditions that even up to now in pregnancy, when they occur, we can't really say why they do occur. You know, but it is still believed that if you have a genetic predisposition, you may come down with gestational diabetes. Some people, it has to do with their body weight. It's believed that for a certain height, if you're above 90 kg, we'll begin to screen you in pregnancy for the possibility of you developing gestational diabetes. Because once you have gestational diabetes, it's uncontrolled. You will most likely have a very big baby, which will, when they come out, might lead to other issues like hypoglycemia. So it's best controlled in pregnancy, but some women might be genetically predisposed to it.
But after delivery, does it clear up?
Yes.
Okay.
It is
automatically by
gestational.
itself?
We can't really, like I said, you can't really put a hard and fast rule that you're expected to clear up. For most people, within 6 months. In fact, some people almost immediately, their blood sugar goes back to normal.
Okay.
Some people takes a while. Just like the same way we have hypertension in pregnancy, that wasn't there before pregnancy, came up during pregnancy. We expect that after pregnancy to go. It may take a while, but we expect that with control of diet, appetite, weight loss back after losing all the weight they gained during pregnancy, all those things would lead to them going back to a normal state that they were before they took in.
Okay, fine.
Interesting.
I know with diabetes, it comes with a whole lot of complications. I was seeing some medical terms that I couldn't really explain. Just for the layman, just break it down to the acute complications you might come down with if you are suffering from diabetes.
Okay. Now let's look at the story from the onset. We have a problem with blood sugar control.
Yes.
Now it's said that over time, this blood sugar control can lead to acute or chronic complications. At the same time, we have what we call micro and macro complications. Now, for example, a uncontrolled blood sugar could cause problem with the eye, could lead to cataract, it could damage the heart, it could damage the kidneys. You understand? At the micro level, we have blood vessels that go long distance from the heart down to the leg. Over time, these blood vessels could really, really narrow down, disturbing the blood flow to very, very long distal parts. There's also what we call lazy leukocyte syndrome. The body at times becomes weak or unable to fight certain infection. In other words, diabetes can actually weaken or lower someone's infection, making you susceptible to pick up infections,
yes.
problems easily. So we have it on a very, very broad array of possible complications. Just like I said, acute cases could occur. A very acute rise in in blood sugar can lead to what we call DKA, diabetic ketoacidosis, or HONK, another form of that, where you could just have an emergency, unconsciousness, fainting, all those issues, seizures could set in that regard. But more problematic at times, the long-term complications to the heart, to the kidneys are very, very important. Because as these things do occur, most of those damages are not reversible damages. They are permanent damages, which could probably lead to death on a long-term basis.
Okay.
So we advise people with diabetes to please control that blood sugar. If you can achieve a good blood sugar control, you have a good chance of avoiding all those complications. And you avoid those complications, 20, 30, 40 years, you could be diabetic, but you'll still be doing fine.
Do well. Okay, so you can actually live with it, you know, if you adhere to all of the rules.
Exactly.
Now, I want to ask, is there anything like immunity in diabetes? Because I know with some disease conditions, for instance, like malaria, there are people with a certain type of blood group who don't really come down with it, you know, as often as the other kind of people. Do you have that sort of thing with diabetes where people who have a certain blood group, you know, sort of like are immune and cannot really have diabetes?
You know, we can't really put that in place. I'll give an example. Generally, we don't encourage smoking as medical practitioners, even in society. We don't encourage smoking. Then somebody comes to you and tells you, I've been smoking for 40 years and nothing has happened to me. You understand? So you could assume maybe it has one thing or another. We can't really put a finger on that. Okay. But overall, we'll tell you that if you're at risk of a disease, avoid those risk factors. Do you understand? If you're at risk of being diabetic, everything associated from smoking to drinking to weight gain to, you know, refined food, because one of the problem with sugar is refined food that releases blood into the blood, that releases sugar or glucose into the bloodstream very quickly. Avoid refined food. You understand? If you can avoid all those things, you'll be fine. So we can't really say somebody is immune to being diabetic. Because like I also said too, we have the one of you not being able to produce insulin. We also have the one of your body actually resisting insulin. We could have diabetes from so many other causes. Even there's a form in which, in an adult, the body just fails to produce insulin. We call it latent autoimmune issue. Don't let me bother you about such terms. But you see, overall, on more issues, we can come up with diabetes from so many other angles. So it's hard to now say that you are immune. If you don't develop type 2 diabetes, possibly you could take a drug or be on a prolonged medication that will elevate your blood sugar. In other words, you've developed it. Some other scenarios can cause it in illnesses and diseases. Do you understand? So we can't put a hard and fast rule for everybody and say, oh, I am immune to this thing.
Sort of
you understand? If genetically you are immune, you should hope that environmentally you are covered and that no disease, no drug complication will make that situation happen.
That's where personal responsibility comes in.
Exactly.
Now let's talk about sugar dependence.
Okay.
People who are not really diabetic, but have a form of sugar dependence. You know what I mean by maybe at some point in the day, they feel tired and all of that. They just need that quick boost of energy, maybe a chocolate bar or a quick soda or something, and then they're good to go again. Is that an indication of something in the offing?
Well, the story is not fully clear. Possibly that person are not eating the whole day, and by 4 p.m. he begins to feel weak. It's definitely hypoglycemic. He has not eaten the whole day. He should have had breakfast. He should have had lunch. He hasn't had it. So if by 4, 5 p.m. you are feeling weak, you are feeling dizzy, you need something to quickly revive it. So you want to take a soft drink, you want to take a chocolate bar to quickly boost it up.
Boost your energy.
At times too, in people who are diabetic, because of the drug medications they are on, possibly they took their medication and they did not eat appropriately, it could crash their blood sugar.
I was even going to ask that because sometimes I have heard of what you just said, that you are trying to control high blood sugar in your system. At the end of the day, some people take insulin and other medication. At the end of the day, their blood sugar drops. I don't understand why you're trying to drop your blood sugar. It now goes down completely.
And then you have to boost it up again.
Boost it up again by taking more sugar. I mean, I don't
this is the reason. This is one of the reasons why we encourage patient participation in their health. You understand? We encourage patients monitoring their blood sugar by themselves. We encourage patients checking those things and reviewing. Now, let's look at the millimole per liter, 2.5 to 5. We want your sugar to maintain between that range. Now, I wish I had a good analogy to describe this thing. But you see, this thing is going too high. Bring it back, bring it back, bring it back, bring it back. If we don't tell you to hold on, you keep pushing to the other side. Like, oh, no, come back, come back, stay in the middle.
Yeah.
You understand? So I'm trying to bring you into the middle. And there are two things I can use. I have things, you eat food that pushes you to this extreme. I give you drugs that pushes you to this extreme. So we need to reach a balance. Now, reaching a balance could not be a one-way thing. Some people could have what we call widely fluctuating. You understand? I'm trying to bring it to that middle. Some people would like, you came with very high blood sugar and you give them a dose and they quickly react, they go to the other extreme. You're like, oh no, let's monitor this thing closely. Then you try and bring it back, then you readjust. All these things are necessary in the reality because it's a dynamic process. It's daily flux, daily time. Even during the day, your blood sugar varies. As a person, your blood sugar varies from time to time. That's why the most reliable one we want to use is the fasting blood sugar. If you have not eaten and you come to me by 12 noon and say you want to do a fasting blood sugar, I'll tell you, Oga, the time has passed. You can't get an accurate value at that point in time.
So when is the best time?
In the morning, 8 a.m., 9 a.m.
Oh, okay.
So that, provided you've not eaten 12 hours before, provided you ate 8 p.m.
the previous
night.
Okay.
So 8 a.m., 9 a.m. So it's a dynamic flux of things going in and things coming out. So in some people, it's not that easy or not straightforward to get a middle point. And at times you give you instructions that, please, oh, madam, your blood sugar is this. If you be on insulin, make sure some doctors will tell you, take your drug when your food is on the table with you. Some people will be like, family and domestic issues. Oh, the food didn't come on time. Oh, I had to rush. Then they take their drug. Or maybe they took their drug and something came on and they had to run and they didn't eat their food. It goes to the other extreme.
Okay.
You understand?
Okay.
So it's people should be actively involved in keeping an eye on this thing so that we can actually find that right balance of blood sugar.
If I really got you straight now, this eating and taking your drugs at the same time, are the drugs for diabetes that strong that when you don't take it with food, you actually drops your sugar level?
Some of them may not affect you, but a good number of them will crash your blood sugar level if you take them and you don't eat.
Okay.
You will slip into hypoglycemia, which may slip into coma. And in some people, if your blood sugar level is very low, you will feel it. They become sweaty, they become jittery, they'll panic. Oh, I need to dizziness, I need to take something. If they don't, they may slip into coma, they may slip into seizures. In some elderly people, they lose all that ability to react to issues. And the man may just be sitting down there and just suddenly collapse. And they rush him to the hospital and they realize that blood sugar is like 40 or 45 milligrams per day, which is extremely low. Then you have to bring in glucose to quickly bring it up. And most people, by the time you bring it up, it works like magic. They rush in somebody, you just give infusion and film is awake again. You understand? So it's like I said, so we've just, in advanced countries where they use more of insulin pen, people know that, oh, this insulin dose is too much for me, this is too little for me. They know, oh, this blood sugar is normal, this blood sugar is okay. They know when their blood sugar level is too low. They have aware, then they seem to want to ingest.
Right.
But then, if you have diabetes now, does it mean you're done with it for the rest of your life?
Now, that is a very important question. And the answer is a yes and a no.
Oh, okay.
Based on what caused it.
Okay.
If, for example, it was due to hormonal issues, somebody has what we call Cushing's syndrome, an hormonal condition that comes with diabetes and hypertension, and the Cushing's go away, automatically the blood sugar issue goes away. Just like when gestational pregnancy comes up because of pregnancy, we expect that after the pregnancy, the diabetes should go away. If you took some drug, maybe glucocorticoids that raise your blood sugar, and you were diabetic and you had to be on insulin, if it was due to autoimmune reaction or some drugs, we expect that after that situation, the damage should be reversible, but not in all cases. But for majority, we expect that this damage should be reversible. But for some people, it is a permanent situation. For people who have insulin, that have been clearly diagnosed to be insulin type, to be type 2 diabetes mellitus, the non-insulin dependent type. In most cases, it is. But there's an angle of reversibility. We can't really ascertain because, okay, I'll give another example why I said there's an angle of reversibility. There's diabetes, there's normal people, and there's a gray area in between. There's a warning period. Do you understand? We call them pre-diabetic. They're not really yet diabetic, but they're not yet normal. Some of them, you don't need to give them drugs. For a good number of them, just tell them, adjust your lifestyle, adopt a more healthy way of living, avoid fast food with refined sugar. If